Hey guys, I'm in London this week and I have updates on Trump's ban on trans people serving in the military, as well as an insurance company that's denying treatment to gay men. Welcome to another weekly debrief. Well, it's been 1 week since Donald Trump's surprise announcement that he was going to ban all trans soldiers from the military, and we're starting to get a clear view of the utter confusion that the announcement is causing. After the announcement, 56 retired generals issued a statement saying that it would hurt military readiness. Coast Guard officials said that they would continue to support their trans troops, and a statement on the military's website says trans soldiers are still welcome. But the White House is gathering lawyers, and they've started talks with the Pentagon about firing trans service members. As many as 15,000 people may lose their jobs. The Trump administration continues to insist that trans soldiers are expensive and disruptive, but they haven't been able to cite any evidence to that effect, probably because it's contradicted by multiple studies. What's more, Trump's ban may be illegal thanks to a 1986 ruling that the Army can't discharge people for reasons that didn't exist when those people joined. Lambda Legal has said that they're going to file suit to challenge the ban, so we'll have to keep a close eye to see how that goes. So, to sum up, the people crafting policies that affect the lives of queer people aren't bothering to figure out if those policies are good ideas, or if they're even legal. But if they're good ideas or not isn't the point of these policies. The point is sending a message that queer people are dangerous outsiders and that queer people should be excluded from public life. And that message can have a devastating impact when it's picked up and repeated. This week it was revealed that United Healthcare, one of the largest medical insurance companies in the country, denied access to an HIV prevention medication to a man because they suspected that he's gay. Let me just repeat that. They denied access to medication to someone for being gay. This happened in the last month, not the 1980s, the last month. A health insurance company rejecting life-saving treatment for a person because he's gay. The company is now under investigation for their policy, which is probably illegal. To be clear, denying this medication doesn't help anyone. It doesn't even save money, because treating HIV is often more expensive than just preventing it in the first place. And remember, they're not denying Truvada to everyone, just gay men. It's another policy that isn't a good idea, is probably against the law, and only exists to express disapproval of queers. Meanwhile, Texas is in the midst of a debate about a law that, you guessed it, would express disapproval of queers. It's yet another trans bathroom ban, and this week a coalition of business groups and Fortune 500 companies came out against the law, calling it bad business. That's helpful, but remember, the point of these laws isn't to be good ideas or even to be legal. The point is to push queer people out of public spaces. So what can be done? Visit equalitytexas.org to take action. If you live in Texas, they'll have numbers to call to stop the trans bathroom ban. And if you don't live in Texas, you can still donate, volunteer, and help spread the word to people who do live there. If that anti-trans law passes, we'll likely see more attempts across the country to make it even harder for queer people to exist in public. You may not feel like military service or bathroom bans or HIV medication personally affects you, but discrimination never stops with just one group of people. It starts with the most vulnerable targets, small minorities, people who can't fight back. We're looking at a coordinated national campaign to make it harder for queer people to exist in public. If these efforts aren't pushed back now, the next targets are going to be larger and larger until no queer person is free to exist safely in public. That's why action now is so crucial, not just for some of us, but for all of us. I'll be in Reykjavik next week and then back home in Seattle, so if you know of any artists or activists or leaders in Iceland that I ought to connect with while I'm there, please let me know. I'm @MattBaum on Twitter. And I'll debrief you next week.